Good morning, everyone. I'm just getting home from a night shift, and I can't stop thinking about this case, and I have to share it with you here. So have a seat. Welcome back to TikTok Med School. The case involves a 5-year-old that was brought in by their parents for complaint of fatigue, body aches, and generalized weakness. They also noticed that the child appeared very pale, and they noticed that the child's urine was very, very dark. The parents also add that the child had what seemed to be an uncomplicated upper respiratory infection about 2 to 3 weeks ago that self-resolved and went away on its own. After that infection resolved, they decided to visit family up in the mountains for a ski trip, and it was during that trip that they noticed that their child was not acting normally. All right, so now you're entering the exam room to examine the child, and immediately you recognize that this is not a normal appearing 5-year-old. They seem very, very lethargic, slow to respond. You notice on the monitor that their heart rate is elevated, and as you get closer, you can appreciate that they do look pale and that the whites of their eyes are yellow or jaundiced. You are concerned that this patient is critical, so you ask your medical team to set up IV access. You make sure that the patient is on a cardiac monitor, and you send off the appropriate blood tests. While you're waiting for those blood tests to come back, you do a secondary assessment on this child, looking for any other clues as to what could be going on. On exam, again, you appreciate that this child is lethargic. They're responding to you appropriately, but again, they're slow to respond. And on exam, they don't have any signs of skin rash, and although they have body aches, they have no focal or specific areas of pain. The parents further add that the patient has no significant past medical history, no significant past surgical history, and the nurse interrupts you because the lab has a critical value to report. The lab wants to let you know that the patient is severely anemic. Their hemoglobin is a 6.0, which is an indication for a blood transfusion. The nurse also wants to let you know that the urine results have come back, and there are signs of blood in this child's urine, but there are no red blood cells. All right, that's all the information that I have for this case to start you off. I'm going to give you some time to take some guesses and think about what you would do next and what could be the cause of this. And when I come back, we'll discuss the diagnosis and treatment. All right, good luck.